Hi again. So now we are going to discuss differential reinforcement procedures. We had covered a lot about assessments and data collection and how to identify the function of the behavior. Now that we have an idea of what is the function of the behavior, we can start doing differential reinforcement procedures, and these are intervention procedures. And they are based on consequences. So they are not antecedent interventions, they are consequences interventions where we are manipulating the environment to increase, decrease, or teach behaviors. And it's called differential reinforcement because now we are trying to change the contingency or break the contingency. So what does that mean? So we have usually an ST, which could be a parent, and then well, I'm sorry, let's just do this again without the underline. I want to show you how to write an example of contingency. So this is how it looks like. So you have this SD, say that's the parent, and then we have the behavior, say it's crying, okay, and then the consequence, or let's say positive reinforcement. Okay, now we already have the function of the behavior, which could be attention. So every time mom is in the supermarket with me, crying happens. Oh, sorry. And then I get the candy I asked for from the store. Okay, so this is called a contingency. Why is it a contingency? Because basically this has been happening over and over again. Now there's a function of the behavior, which is tangible, the candy. The SD is mom, which means whenever mom is present and in a supermarket, I'm going to cry. The setting is a supermarket, mom is the SD. Because if grandma was with me, most likely the crying behavior will not occur. Because from previous experiences, grandma is not an SD for candy. Okay. When I cried over and over again, grandma did not give me candy. So the behavior of crying only happens with mom, which is SD, as we discussed before. Okay, so now we have the function of the behavior. We know that it's tangible. So based on this, when you see this is a contingency, and the contingency looks like that, SD, without any like terms here or labels of what's happening in the environment. It will look like this, SD behavior. Keep doing this, and then reinforcement, and it looks like that, something like that. Okay. Sometimes the B is written as R. You will see that too. Okay. Now this is a three-term contingency. Antecedent, behavior, consequence. A, B, C. It gets complicated if there's an MO, motivation operation, as we discussed. You'll see it here. Something like that. Okay. And you remember the MO is a momentary effect on the value of the reinforcement. Okay. But this is not what we're interested in. Now we have this three-term contingency, mom, crying, candy. Okay, so now we want to decrease this crying behavior And we're going to do that with differential reinforcement. Okay? So how do we do that? What is differential reinforcement? Now, there are kinds of differential reinforcement. Before I go over these kinds or types, let me tell you that differential reinforcement is basically, simply, you are manipulating the consequence, which could be a reinforcement or a punishment. And in this example here, differential reinforcement, which always work on the consequence of a reinforcement, okay? It cannot be used with punishment. It's basically called differential reinforcement. Is that you are going to stop reinforcing what you used to reinforce before, okay? So this mom who's reinforcing the crying with candy will stop giving candy after the crying, and then she will give candy some other time. And when does she give candy? That's where the types of DRs come in, the differential reinforcement types. How do we decide when to give reinforcement? Based on the schedule of reinforcement, based on the kind of the DR, differential reinforcement procedure we're using. And of course that is determined by what are we working with, what are we trying to do. Okay, so here we have a contingency. We're going to break the contingency by doing a differential reinforcement. You have the reinforcement you are giving in your procedure or in your intervention has to have the same function. Okay, so if it's candy that was reinforcing the crying, candy has to be used. But in the process of intervention, you're not using it after crying, because the whole goal is that you're trying to decrease crying. Okay, so let's see the types of DR, or differential reinforcement. We have DRO, differential reinforcement of other behavior. Okay, so O is for other behaviors. We have DRA, alternative behaviors. So the A is for alternative. Okay, we have DRI. I is for incompatible. Behaviors. There are also DRL, DRH, DRD. The L is for lower rates of responding. DRH is for high rates of responding. And the D stands for diminishing rates. Okay, now of responding, of course. Now, our main kinds of DRs are the first three. Okay, I'm gonna highlight them, and let's go over one at a time. So, we're gonna use this example here of the mom in the supermarket. The kid's crying. The reinforcement is candy. And our goal here is to decrease the crying behavior. Okay, now these three can be used. They're a little bit more complicated than the first main ones here. I'm going to go over them briefly after we go over the DRO, DRA, and DRI. Okay, so I'm going to move them a little bit here out of sight so we won't get confused. Okay, so DRO is differential reinforcement of other behaviors. Okay, so we are reinforcing other behaviors that happen instead of crying. What does that mean? It means that if we're in a supermarket and this kid is doing something appropriate, he might be requesting candy politely. He might be following supermarket protocol. He's walking with his mom, nicing her hands. He could be saying good morning to a neighbor. Anything that you believe to be a good behavior other than crying, you can reinforce. And this one gets a little tricky because you're basically reinforcing any behavior and any behavior with candy. So you have to be careful when you decide to choose DRO, because you don't want to give candy or purchase candy for a child every time you're in the supermarket, or if you are enforcing other behaviors maybe at home with candy, you don't want to be giving him candy all day because he's doing something other than crying, because all other basically means anything other than crying. So if you're doing DRO, if he's doing anything at home other than crying, you continue to give him candy, and that might be problematic for this specific example we have here. DRO are most likely used with very high frequency behaviors. If the kid is doing one behavior most of the day, then yes, once he stop it and do anything else, you give reinforcement. It has to be anything and everything other than the behavior at hand. So DRO, again, is not very good with this example. Because you will end up giving this kid or purchasing candy for this kid every time you go to the supermarket. If you're doing it at home and he's crying for candy at home, you'll be giving him candy all day, and that would be a problem. Okay. Now, if this kid is crying the whole day, which I doubt is the situation here, usually he's crying at the specific time for candy. If he's crying all day for candy, then maybe DRO is a good idea, because once he does something other than crying, then you give the candy. Okay. So it's for really high rates or frequency of behaviors, or the behaviors that happen at a very high frequency. Then you try to break the contingency by enforcing other behaviors. Okay, so how about DRA? So DRA is that you're choosing another behavior that you know that the child is capable of doing, and you're enforcing it, but you're not enforcing the crying. Okay, so when we use this also for teaching new behaviors or for replacement behaviors, which means you are going to ignore the crying, and once the kid asks you nicely for candy, then you're going to give him candy. Sometimes when they cry and they don't know how to request something, you want to intervene and say to them, you have to ask without crying, and wait until they finish crying, and then they request what they want, and then you will give them the candy. So now you are reinforcing the asking politely, and you're ignoring the crying. However, you have to know the skills of your client. So if your child is crying because he knows the crying bothers you, and you're gonna give him candy every time he cries, you really want to ignore that to break the contingency. And remember, extinction means that a behavior that was reinforced earlier is no longer enforced. And usually the outcome of extinction is a high increase in the behavior and then a gradual decrease. So yeah, the first couple of times you're in the supermarket and he's crying, you're not giving him candy, he might start screaming really hard, throwing tantrums, he might throw himself on the floor. It's difficult at the beginning, but then gradually, maybe the third or the fourth time in the supermarket, you wouldn't see the crying at all. Okay? So you are mixing two things when you're doing DRA. You're doing extinction for the crying behavior, which means you're not longer enforcing it, and you are enforcing an alternative behavior, which could be asking for the candy nicely. Or it could be eating dinner. Okay, so you could say when he cries, after crying, you know, if you eat dinner, I'll give you the candy. And then when he cries again, now you say it only once, and the next time you're in the supermarket he cries again, you ignore it because you're doing extinction. You do not give the candy. Okay, so that's differential reinforcement using alternative behavior, which again means that you are enforcing another behavior that you want to increase, a replacement behavior. And you're enforcing it with the same thing, candy, and you're putting crying on extinction, which means you're no longer enforcing it. DRA are used with students or kids who might have speech delays or communication delays or social delays, because you want to replace the crying or screaming or tantruming with speech, with communication, with initiation of requesting items. And with the DRA part, you are also teaching a replacement behavior. And that's also used in something called functional communication training, where you train students to communicate in a functional way to get what they want instead of inappropriate behaviors. And with the FCT or functional communication training, you are using DRA procedure. Okay. Now the third one is DRI, incompatible behaviors. And incompatible behaviors, basically, you are enforcing a behavior that cannot be happening with the crying. Okay, it's incompatible to crying. So he cannot be crying and smiling at the same time. So you want to enforce the smiling. Okay, because when you enforce the smiling, you cannot be doing both, crying and smiling. So the smiling will take over because it's incompatible behavior. It's going to take over the crying, and then it will continue to increase. Okay. Maybe smiling here is not the best example, because smiling usually does not provide candy or does not indicate that he wants candy. But what you can do is, if the kid is with you, he's displaying pleasant behavior and he's smiling in the supermarket, listening to you, then you take this and you use it to reinforce the behavior. Also, asking for candy is an incompatible behavior because you cannot be asking and crying at the same time. Okay. However, we see incompatible behaviors used mostly with physical behaviors, aggressive behaviors. So say if the function of the behavior is attention, and the kid is slapping himself or scratching himself for attention, and the scratching or slapping behavior has been reinforced because every time he does that, he has someone running to him and asking him to stop and talking to him. Now what we can do, because we can't really ignore a behavior like that because it's harmful, we cannot put in an extinction. We can put an extinction with different methods, but what I'm saying is that extinction for attention usually is ignoring, and if you're going to ignore behavior like that, it might cause a lot of harm. So what you could use is a DRI, which means you can provide this person with an assistive technology device that talks, because most likely individuals who cannot verbalize are the ones who participate or engage in self-injurious behavior to get attention. So what you want to do is you want to give them something that is incompatible. So if they are using both hands to hold an assistive device and press a button that says I need help, or says bathroom, or says food, whatever it says, they are using their hands to do that, and they cannot be using their hands and scratching at the same time. So that's an incompatible behavior. The both of them cannot happen at the same time. Okay, and since is using a device, you are going to enforce him by the attention, but now you're enforcing an appropriate behavior using the device, not the self-injurious behavior. Okay, so this is differential reinforcement procedures. So a lot of parents would benefit from knowing this. Even though many of you are interested in becoming RBTs, also there are many people who are doing this training to help with parenting and to be able to interact with their kids at home. So definitely, if you have a child who engage in a behavior like aggression, or kicking or hitting, or even crying or screaming, you want to use differential reinforcement. You want to first find the function of the behavior, like we, decided at the beginning how to do it. And again, you're supervised, so even if you're a parent, it will be good to have supervision every once in a while to help you figure out what's the function of the behavior, what to do, what kind of differential reinforcement you want to use. Because again, you have to be very careful. You don't want to reinforce an inappropriate behavior, and then it will become a problem. You will maintain or increase an aggressive behavior. So really have to be careful. You have to consult with the BCBA when you're doing these procedures. So yeah, again, so basically if you have a son or a daughter or a client who is engaging in a behavior that is of a concern or really not appropriate due to performance deficit, not necessarily a skill deficit. Skill deficit we'll talk about later when we're trying to teach a new behavior, like speech, like labeling, like answering name, answering questions, socializing. All of these are skills that we can learn, we can teach with ABA. But when it comes to decreasing a certain behavior that you do not want to see, you really have to find what is the function of the behavior, why does it happen, use whatever the reason is or what comes after the behavior, and introduce it after another behavior that is more appropriate, and do not reinforce it after this behavior you're trying to decrease, and that's called breaking the contingency. So here we have mom crying candy. How are we going to break the contingency? We're going to take away the candy, and we will say mom requesting, and then we'll put candy. Okay, so here there's nothing. We'll put extinction. Sorry. Okay, which means no longer presenting candy or enforcer. Okay, so here's a contingency. Here's our example. And here's the differential reinforcement. Differential reinforcement, really, when we say differential reinforcement, we are including these two, because you cannot put candy after requesting and candy after crying. You would not change anything. You really have to put crying on extinction, which means no longer providing candy, and you put candy after an appropriate behavior like requesting. So figure out how you do this with your clients, or if you're a parent, how this has been, like a certain behavior has been reinforced. Okay, again, it depends on the client. You really need to consult with someone, because maybe your kid cannot request. He doesn't have the speech to request. So what is the other things you could teach him? So maybe you can teach him a DR, like using DRA, you can teach him to point. Okay, so pointing would still be better than crying, and it will be a step forward to requesting appropriately. Okay, so these are the three main ones that we most likely use with our clients. Now let's look at these three here. DRL, lower rate of responding. DRH is a higher rate of responding, high rates. DRD, diminishing rates. What does that mean? So the DRL, so if you have a student who engages in a specific behavior, you want to first know what is the frequency of this behavior. So I say it happens 10 times in an hour. Okay, so now our goal would be to reduce it. So first of all, we're not going to put our first goal to reduce to 0 times an hour. That's just impossible. Maybe the first step we would say, okay, 8. If it happens 8 times or less, then we're going to reinforce it. So we are giving it's lower than baseline. Baseline is 10 times an hour. We're going to go with a little bit lower than being like 8. And then we are going to provide the reinforcement. Okay, so the whole point, like I'll give you an example. So you decrease the number of bites per minute. So if a kid is biting himself, you want to decrease it by increasing the time between bites. So this is something you could use with inter-response time. Okay, because as a behavior happens, remember we spoke about inter-response time is the time between the consecutive behavior. So if he's biting himself every few seconds, we want to increase the time between one bite and another. So we would say, okay, if this person, instead of biting himself every 5 minutes, we want it to be every 10 minutes. So any time, any inter-response time between of 10 minutes or more, then it gives reinforcement. Okay, so it could be used inter-response time. It could be with rate. So this behavior happened 8 times or less in an hour. Then we will reinforce it. It gets tricky, so it's the program has to be very specific to what you're doing. Usually DRL does not eliminate the behavior, it just reduce it. Okay, you're not targeting an elimination of the behavior, but rather a decrease. And most times it's used with inter-response time. So if you have a student who is answering questions very quickly without thinking, you wanna give him a time limit of higher time. So if the question is that's latency. So if you have a question asked and then he's answering 2 seconds after the question is asked, you're not going to reinforce. So we'd say if he answered the question after 6 seconds or more, then we'll reinforce. And the whole idea is to increase this time of latency in this specific example until the student actually take the time to think and answer the question correctly. So it's not a the program is not one goal where it's only like 5 seconds or more and that's it. No, you're gradually increasing the time. So the 5 seconds become 10 seconds, 5 minutes maybe, and so forth. Okay, and that's the whole point of reducing a rate of a behavior, rate of inter-response time, or the time of latency. Now DRH is the other way around. So the student or the child must engage in a specific behavior at a high rate than baseline in order to get the reinforcement. Okay. So for example, the number of times the student raises his hand. So this student raises his hand 2 times only per day to answer questions. Now the baseline is 2, so you don't want to go far to 10. You want to maybe say, okay, 4 times. So if this student raises his hand to answer a question 4 times or more, then we will give him the reinforcement. And here you are increasing. The whole point of the DRH is that you're increasing the frequency of a behavior, and it's basically the opposite of DRL, or it's the other way around. Okay, DRD is to eliminate. I mean, it's not to eliminate; it's to reduce it. And again, it does not eliminate. And it's like DRL. The only difference is that DRL is mostly used with inter-response time, where you want to increase the time between consecutive behaviors, and that's why you're lowering a rate of response. But diminishing DRD is mostly engaging in specific behavior at a rate lower than baseline. So you are just decreasing the amount of frequency for the reinforcement to take place. So these are a little confusing because they're used with very specific behaviors when it comes to DRD, DRH, and DRL and the way they're presented. However, you might be using them if they're part of the program that you have to follow. And at that time, you have a very specific way of following it. So you shouldn't worry about these. You just need to have an idea of what they are, because you will be implementing or assisting in implementing those differential reinforcement procedures. Now also, there are subtypes of DRO. Let's go back. Okay, the subtypes are basically, we covered the reinforcement schedules, which are fixed interval, variable interval, fixed ratio, and variable ratio. So when we are using DRO, we are using fixed interval DRO. Let's write that down. Fixed interval DRO. We can also use variable interval DRO. There's also fixed momentary DRO and variable momentary DRO. Remember when I was saying that it's really hard to use DRO on specific behaviors, because it's basically saying that anything else happening in the environment or any other behavior happening other than the ones we're trying to reduce have to be reinforced. So if again it's crying is our target behavior to be reduced, we're reinforcing everything else, all other behaviors happening. But that's impossible, and that's why we have to use one of these: the fixed interval, the variable interval, fixed momentary, and variable momentary. Let's review these. The fixed interval, it's basically fixed time. So we can put a fixed time of 20 minutes. So every 20 minutes, if there's no crying, we are reinforcing whatever behavior we're seeing, but not the one that we're trying to reduce. Variable interval is we have an average of say 20 minutes. So that means some time around the 20 minutes we'll be providing the reinforcer if crying is not happening at that time. So if the average is 20, so you're going to look every 18 minutes, every 25 minutes, every 16 minutes. It's an average of 20. And again, after the 20 minutes, we look up and we see, I'm sorry, we don't look up, that's a momentary, but you could also do it with an average of duration. If the kid is not crying for the last 20 minutes, then we are going to provide a reinforcement regardless of what behavior he was doing. Okay, fixed momentary and variable momentary, again, it's a time-based schedules, but it's based on the moment. Fixed interval and variable interval are durations, so if every 20 minutes the kid has not cried, you provide an enforcer whatever he was doing. But the fixed momentary is that you are just setting the timer. Every 20 minutes you're looking up, and if the behavior you're seeing is not crying, then you're reinforcing. If it's crying, you're not reinforcing. That's why you're differentiating the reinforcement. The variable time, momentary is the same thing. You have an average of a time, and every, say, 15, 18, 23 minutes you're looking up, and at the moment, if the kid is not crying, then you're enforcing whatever behavior is happening. And it's average, so you could set the timer around an average of 20 minutes. Okay? Because you cannot possibly be enforcing all the behaviors happening in your environment all the time. Okay? So this is differential reinforcement. It's a very good strategy. We use it most of the time. But first you need to know, why is the behavior happening? What is reinforcement? And then go into finding another behavior that you will reinforce with the same reinforcer. And you put the behavior that you would like to reduce on extinction, which means you're not reinforcing it anymore. Okay, so if you have any questions about DR differential reinforcement procedures, please let me know. Thank you.